Welcome to episode 5 of Rideout Connection. I am your host, Rick Rawson. I'm the president of Adventist Health and Rideout, and I want to thank you for joining us today. As you can hear the sirens in the background, we're up here on the third floor out in the garden patio that we hope to get open soon and have a beautiful garden out here for staff, and we're looking forward to that happening. I want to talk a little bit about what's been going on. We're seeing a little bit of a plateau right now with COVID-19 in our hospital. We're cautiously optimistic. We're on the downside of our surge, but still being very vigilant because we could see another post-Labor Day surge and are watching those positivity rates very closely. This surge really impacted every part of our hospital. And I just can't say enough to thank all of you for what you've done. This has impacted every single department, and I'm so grateful for the work that you do each and every day. What we saw this time really, I think, in many ways was more significant. And Dr. Graham, who is my guest today, will talk a little bit more about her perception of this, but we've seen a lot more patients in critical care than we even saw in our winter surge, and I know it's been a challenge. So I want to thank really all the staff who've done so much. This week we commemorated 9/11, and as if you were anywhere near a television, you saw a lot of programs commemorating 9/11. And one of the things I'll never forget is the pictures of the first responders who are running towards the building when everybody else is running away. And I couldn't help but think of the analogy that we're facing here with this pandemic. Because when the people who call it a hoax, who are avoiding vaccines, who don't think they need to wear masks, they're the people running away. But all of you who are taking this seriously, providing leadership, getting over your concerns and fears to get a vaccine to keep you and your family safe, you're the one running towards it. And the difference between what happened on 9/11 and this pandemic is those of you running towards it can actually make a difference. You can save lives, you can keep the building from falling down, and you're making a difference each day. So I just want to thank all of you for the courage and the bravery, the leadership, and your care for your community, your family, and your patients that makes such a difference. So thank you for what you're doing. A couple other pieces of news before we go on. I saw a picture yesterday posted from the cath lab. We did our 50th ablation. We just started that in April of this year. Dr. R.P. Singh and the team were there posing after their 50th successful ablation for our electrophysiology program. So we're really, really proud of this. We're proud of what the cath lab has really been leaning into and doing as we continue to grow our Heart and Vascular Institute. So with that, I want to introduce my guest today, Dr. Camera Graham, who is our medical director of our emergency department. Dr. Graham joined our hospital right before the Cerner transition. None of us knew that COVID would be coming right after that. She's been an inspiration to me as we pulled together our command center. She was there every step of the way, and I'm just so grateful for your leadership and what you've done for our community here. So thank you.
Thank you. Thank you so much for having me.
So one of the things I want to talk about with Dr. Graham is really we talk in each of these about story. We talk about how our story to all come together here is how we serve our community. So I want to ask you, what is your story and what led you to be a physician, and how does that resonate with the work you do here at Adventist Health and Rideout?
So it fits in quite well with the position I'm in now. I grew up in Kelseyville, which is in Lake County, just down Highway 20 from here. And I initially loved medicine because I saw my sister have open heart surgery when she was 3. and I knew those docs patched her together. At that point, I thought they had taped her heart back together. And all I knew after that was I wanted to be a doctor. In high school, I took the EMT class and I started working for Kelseyville Fire Department. And I worked there through all of high school and undergrad, and that's really how I paid for my education. And that really gave me the drive to want to do emergency medicine and to be able to see anyone who walked through our door without having to ever question, could they pay for their care? Did they have the resources to get there? We could take care of anyone that came in. I started my career down in Sacramento, and then when this opportunity came up, I jumped on it right away to be back in a community very similar to the one that I had grown up in, and a chance to kind of give back and live my purpose in a similar community.
As we've seen this pandemic ebb and flow, what's your perspective? What are you seeing right now with the Delta variant that we're dealing with in the hospital?
So the Delta variant has by all means been much worse than the first wave. We thought during the first wave, we made it through, we've got our system down. And then when we got hit with the second wave with the Delta variant, it's been a whole new ballgame for us. We've been seeing record patients higher than we've ever seen in the history of the hospital. On top of that, we've had a lot of patients that are here for a lot longer in the hospital. So there isn't the ability to move patients through the emergency department and into the ICUs and onto the floors. And so I know our staff has done a tremendous job in being able to transform the emergency department kind of at the drop of a hat. And they have weathered through all of this. And I'm so very grateful just for the team that we have down there and for our counterparts in the inpatient unit that have come down early, that have rounded, that have been supportive. It really has been a team effort, but by all means, the Delta variant has been nothing like the first wave.
Mm-hmm. What are you seeing from the patients who are dealing with this? I've heard that it's impacted people that were not vaccinated much more than those that have been vaccinated.
We've followed suit with the rest of the country in that the patients who are unvaccinated are by far the majority of our patients. There are still some breakthrough cases in patients that have been vaccinated, and as we know, you can still get COVID and spread the variant even if you are vaccinated. We've been seeing a lot of the patients though that are unvaccinated have much worse disease process and are very much more likely to end up in the intensive care unit or on a ventilator. A lot of what we hear from our patients though is unfortunate that by the time they get to us, by the time they're going to the ICU, they really wish they had gotten their vaccine. And so we've been trying to do a lot of education in the emergency department. We've been offering the vaccine in the emergency department. And we're here to really help educate and try and help prevent some of these infections if we can.
So it's been amazing how our team has come together. What have you noticed about the teamwork in not just the emergency department, but really throughout the hospital? And what do you want to say to the other physicians and our staff who are working together so well?
I think thank you is not enough by any means. It's been fantastic to watch every single person, from the physician to the advanced providers, the nurses, the techs, our EVS staff, even our cafeteria workers. Everyone in the hospital has really had to be willing to be flexible and change everything that they do on a daily basis. The team we have here is beyond amazing. I wouldn't want to be going through this pandemic in any other place with any other team because they are all supportive. This is very much a small town, and we are a small town team. We care about each other, we check in on each other, and I know everyone is exhausted at this point. But it is that love for each other and that caring that is what got us through. Our medical staff has been fantastic. All of the consultants and the intensivists, the inpatient physicians have really been our partners in all of this and have had open ears and been willing to change their rounding schedule and to come down to the ER where I know they don't always want to be. But it really is the team that has gotten us through.
Well, that's great. So what do you want to say to the community? I mean, we make this available to the community as well. What message do you have for them?
I think the biggest message that I want to share is that we are coming to you out of love for the community. We are here to care for you in your time of need, whether that's from COVID or a car accident or heart attack. We are here and we're here to take care of you. But we need you to help us as well. And the best way for us to help keep you healthy and to help keep our community open and functioning is to get the vaccine, to wear masks, to social distance. And if they have questions, to please let us know. We're happy to come to your church, to your community events. If people have questions, just let us know. We're here to educate, and it really is out of a place of love for our community and not wanting to have to see any more people unnecessarily sick in our intensive care unit.
Yeah, thank you. Thank you for your time today. I really appreciate that. And thank you for joining us. I do have one shout out. Tuesday, I had the opportunity to go in the cafeteria, and while Maria usually brings me over to the hot plate and sells me whatever she has, Laura Pendergrass was making chicken tacos. And I just want to say this. I've had thousands of chicken tacos in my lifetime. And the chicken tacos I had Tuesday were the best that I have ever had. And so a shout out to them. They make such a huge difference. And through all of this, they have been there supporting our entire team. Show them your appreciation, because they're giving you some of the best food in Marysville. So thank you again for your time today. We look forward to seeing you for the next episode.